Thank you very much. Dr. Gruber, you have the dubious distinction of having generated more buzz in the district that I represent than anybody but Eric Holder when coming up before this committee. And so I apologize if some of my questions are disjointed. Several of them come from Twitter, from folks who wanted me to ask a question. One I got was, why won't he answer the question? But I'm going to translate that more into, put my lawyer hat on and re-ask that. With respect to questions about the money that you made consulting on Obamacare from the both Federal and State government, you've constantly lawyered up or not answered the questions or not recalled. I want to be perfectly clear. This committee has government-wide jurisdiction. We are the taxpayer watchdogs. I am asking you right now, flat out, to provide a detailed list of every penny of taxpayer money that you have made from the government consulting on Obamacare, be it from the Federal government, be it from the State on a federally funded grant, or from a State. I am asking you to provide that within 30 days. And I would look forward to you providing it to the committee, and we'll work with Mr. Chaffetz, the incoming chairman, to subpoena that if it's not supplied voluntarily. So let me go on to a couple of questions. Do you feel bad about taking all this money from Obamacare from people you call stupid?
The money that I received from my economic consulting work was compensation for the quality work I did in economics and modeling, and so I think it was appropriate. Okay.
You had 21 meetings at the White House. You met once in the President's office. You talked to him. Based on the information you provided, things you heard in this meeting, these meetings, and your general understanding, do you believe that the administration was truthful and transparent in the things they said working up to the passage of Obamacare, like if you like your health care, you could keep it?
I believe that the discussion of the Affordable Care Act was fully transparent, and there was enormous discussion of all of the aspects of the law.
Do you feel like, well, you testified earlier that you knew there was going to be some churn. Do you feel like you were complacent in presenting the Affordable Care Act in a dishonest or untruthful manner, and is that something you would like to apologize for as well?
The numbers that I presented as part of my economic modeling to the administration and Congress were all to my best of my economic modeling.
But you knew some of the things that the administration were saying, some of the things in the debate were not true. Why didn't you raise a red flag? Wouldn't that make you complacent?
I'm not a political advisor. It's not my job to discuss what the President's saying or not saying.
Let me just, this is another question from Twitter. Did your insurance get more expensive? Are you paying more for it, or did your deductible go up?
Health insurance costs in America have gone up every year for the past 50 years.
Did yours go up substantially more when you fell under the Affordable Care Act than it had in past years?
No, it did not.
Mine sure did. Let me see, where else do I want to go? When you were talking to Mr. McHenry, you said that the Affordable Care Act did not solve the problem of rising health insurance costs. You went on to say that it was a first step. What are the next steps?
The next step really, in my view, is to learn from the first steps that are implemented by the Affordable Care Act, to learn what's working and what's not, and to try to build on that towards stronger cost controls in the long run.
So if you were to sit down and write a new Affordable Care Act 2.0, what would be the top 2 or 3 things you would want to include in it?
Right now, the number one thing I would say is that we need some time to see what is happening with what we did in Affordable Care Act 1.0, to learn from that, and then to not be in a rush, but rather to sit down having learned from that and take the next necessary steps.
Would you consider the ultimate solution to rising health care costs to be a single-payer or government-run system, a completely government-run system?
I don't think there is a single ultimate system to rising health care costs.
All right. Now, you've also been thrown under the bus by the President as just another advisor. I think I would be insulted by that, based on certainly by the Washington Post article that said how key you were to that. you want to come clean and just tell us if you told them any of the things that they were saying were untrue and who you told and tried to stop them. I guess that kind of loops back into my, my complacency question. Could you have stopped some of those untruthful statements, and why didn't you? And would you like to apologize for not doing that?
I'm not a political advisor.
All right. Well, I'll yield back. Thank you, Mr. Chairman.